I am your host, U.S. Army Flight Surgeon and Iraq Combat Medic, Colonel Dr. Damon Arnold. And I have a special guest with me today. When she's on the show, you need to sit down and listen because she is really on top of her information. This is Julie Appleby. She is a senior correspondent for KFF Health News. And that foundation, the Kaiser Family Foundation, really is plays an essential role in looking at our health in the nation. And today's discussion is going to be about Julie's KFF Health News article entitled Anti-Fraud Efforts Meet Real-World Test During ACA Enrollment Period. So the Affordable Care Act is what we're going to be focusing on today. And, welcome, Julie.
Thank you for having me. It's always good to be here.
So tell us a little bit about open enrollment for the Affordable Care Act. When did it start and how long does it last?
Yeah, this is the time of year when people who buy their own insurance through the Affordable Care Act, which is also sometimes called Obamacare, can shop around. They can look at different coverages. They can change plans if they want. They sign up. They can get premium subsidies, that type of thing. So it started on November 1st, and in most states, it runs through January 15th. Although if you want coverage that starts January 1st, most states you've got to sign up by December 15th. So folks tell me, don't wait too long. But that's open enrollment. This is the one time a year. There's other sort of special enrollment periods, but this is the annual open enrollment period for everybody.
Okay. Are veterans eligible for ACA? Because, some people are confused about that.
Yeah, that's a good question. If you're enrolled in TRICARE or the Veterans Healthcare Program, you're considered covered. So you wouldn't be able to enroll. But if you don't have those programs or your family doesn't have them, then you would be eligible to, and you don't get insurance from, a job or some other way, then yes, you could certainly sign up for the Affordable Care Act.
Yeah, because, many of our veterans, they are, they don't do a career path, they don't do 20 years or, become eligible for TRICARE. So many of the veterans, do a short tour, but they can have devastating consequences in their life, loss of a limb, PTSD, other kinds of traumatic brain injury. And they are still out there. Some of those will be covered by the VA for injury care, related to combat activities and that kind of thing. But in general, their general health care, it's still up in the air sometimes. And if they don't stay connected to the VA, they can be out there by themselves. And a lot of the OEF, OIF, the younger, veterans who are here now aren't connected that way. So I'm glad you said that, you could still be eligible if you're not connected to the other systems. But is there financial assistance to help people get covered?
Yeah, there really is. The Affordable Care Act comes with premium tax credit subsidies that help people cover the cost of the premium. And in fact, I think this year more than 90% of people who have bought coverage get some kind of help with their premiums. And these are generally in the form of like tax credits. And they go towards the premium. And in some cases, I think there's millions of people who completely have zero premium plans because their income is such that they can get a plan for nothing per month. But other people, it helps pay part of that monthly premium. And the subsidies are based somewhat on your household income and also the cost of plans in your area. So there is financial help. Also, we should talk about this. There's enhanced subsidies. For about the past 5 years, the subsidies have been larger than they were when Obamacare first rolled out. So during the height of the pandemic, if you'll remember, Congress passed a number of pieces of legislation, including one called the Inflation Reduction Act. And those included enhanced subsidies. So what that did for people is at the lower end of the income scale, folks will spend a little bit less of their household income toward the premium than they did before. So at the upper end, though, it dropped this thing called the cliff. It used to be called the subsidy cliff, that people would just fall off because at 4 times the poverty level, there were no more subsidies available. So if your family made $1 more than 4 times the poverty level before this passed, then you didn't get any subsidies. But now that cap is essentially lifted. And what happens is that if you make more than 4 times the federal poverty rate, you can still potentially qualify for a subsidy, but it would be after you've paid 8.5% of your household income toward that premium. And then the subsidies would pick up whatever remains of that premium cost per month. So that's a little complicated, but those enhanced subsidies were put in place by the Inflation Reduction Act.
Yeah, because that was signed, I think it was August of 2022. Yeah, and it's an incredible bill when you start looking at the components of the 3 major components of it, and that really did benefit veterans.
There are a lot of veterans, a lot of people. So there's estimates that about 20 million people out of just over 21 million who are currently enrolled in the ACA get some form of these enhanced benefits. So it's a lot of folks. Just so you know, the enhanced subsidies do expire at the end of 2025. So I fully expect that there will be quite a debate in the coming months as to whether those enhanced subsidies will be extended or not. And it could make a lot of difference for folks because, like I just said, a lot of people get them. And there's estimates that they offset about 44% of the cost. So if those enhanced subsidies go away, a lot of folks will probably see premium increases. But if you're enrolling for next year, if you're in open enrollment right now, all the experts tell me, don't worry, whatever the premium you sign up for and the subsidies, those are going to last through 2025. Those aren't going to change unless your income changes or there's some other factor. But the enhanced subsidies won't go away next year, but there will be a debate in Congress about whether to keep them or modify them or let them expire.
Wow, that's really valuable information. People need to know that that's actually a protection that's there for them. But 44% is nothing to sneeze at when you talk about that support. But how do people actually enroll?
Well, there's a number of ways. Basically, what most experts suggest is you just go to this website called healthcare.gov, which is the federal marketplace. And even if you don't live in one of the 29 states that uses the federal marketplace, there's a little drop down thing. You type in your state and it'll show you where your state marketplace is, because the states that aren't participating in the federal marketplace have their own. But there's a caution. If you just sort of Google, Obamacare or cheap health insurance, it might not pop up either the healthcare.gov site or your state marketplace. It might be a broker or marketing firm or some other thing that may not be the official marketplace. And if you want a subsidy, you need to enroll through one of the official state or federal marketplaces. So that's one thing. You really want to make sure you're on the state or federal marketplace if you want to get one of those subsidies. But secondly, some of these sites that pop up might be selling you non-ACA plans that may not have the depth of coverage or the benefits. They might be less expensive, but they may not be the right plan for you, or may not, but so you just have to be careful that if you want an ACA plan, you really need to make sure you're on one of the federal or state marketplaces. So that's the first thing. And then a lot of people want some additional help. You can go on there yourself and you can type in your information, where you live, your income, what kind of plans you use, what you're interested in, and search for yourself. And you can compare plans and you can look on there and say, hey, is my doctor in the network that I'm thinking about? Are my drugs covered? And there's ways to check that out. And then you can compare, what are the premiums for this plan and that plan? And most of the experts say, don't just look at the premiums, but look at how much your deductibles are going to be and how much will it cost you every time you go to the doctor and that type of thing, to try to figure it out. And that can be really complicated and really overwhelming. So a lot of people turn to brokers, insurance salespeople, and they can help walk you through it. So there are sales brokers that will help you. They don't charge you. They get paid a commission by the insurer, but that's by the insurer. And also there's non-commission paid folks called navigators or assisters, and you can reach them by either calling the healthcare.gov marketplace or your state marketplace, or going on the website and clicking on a button that says find local help. And you can find navigators or assisters, and you can also find brokers and sales brokers through that. So there's a number of ways people can enroll, and there's a number of ways you can get assistance to enroll.
Yeah, great. Yeah. So, is anything happening new this year that, that people need to be aware of?
There's a couple things. The premiums have gone up probably on average about 7%, and some insurers have pulled out of the market and some have joined. So you want to go in and check, even if you're currently enrolled. Everybody says it's a good idea to check around and just shop a little bit, see what else might be available, see if your plan is still there, see if it still covers the doctors and hospitals and other providers that you want. So that's not new, but it's something that people should do every year. And that's probably the main thing. There, and we'll probably get into talking about this, but there's another situation that might slow things down a little bit, where you might have to do a phone call with healthcare.gov. But those are the main things that have changed.
In your article, you've also written about the problem of people being enrolled or switched from one ACA plan to another without their express permission. And also, maybe you can tell us about that and what is happening with these unauthorized enrollments. I remember back in the day, about 20 years ago, people were switching you from one telephone company to another. So we've gone through the switching thing before, but how does this?
Those kinds of things happen. I hadn't heard about the phone one, but this has been a little bit of a problem over the last couple of years, but it really took off during open enrollment last year and then in the early parts of this year. And from the reporting that we've done at KFF, people are getting signed up, or enrolled, or switched to a different plan without their knowledge in several different ways. And it can cause a problem, because if you are in one plan and you think you're in that plan and you go to the doctor, but suddenly that doctor doesn't take your plan anymore, like, wait, I didn't change my plan. So people are showing up at the doctor, they're showing up at the hospital, they're showing up at the pharmacy, and their plan is not the one they thought they had, and it may not be covered. So that's one problem for consumers. And another problem is if they were enrolled in a plan that they didn't qualify for, maybe they had job-based insurance, and so they don't qualify for Affordable Care Act coverage, but yet a premium tax credit was granted in this unauthorized enrollment. Those folks are getting what are called 1095 forms at the end of the year for taxes. And they're thinking, wait, I'm not in this plan. And they might actually owe back taxes on those premium tax credits that were paid out, even though they never enrolled in that plan. So there's all kinds of problems. This apparently started with some brokers wanting the commissions that are paid. And so they were signing people up for these plans, whether they kind of understood it or not. So that's part of it, that brokers who have brought this to the attention of the government, I'm going to say that some of the very legitimate broker groups have had this concern for a while, and they blame much of the problem on how easy it is for some of these rival agents to access information in the federal marketplace. They basically only need somebody's name, date of birth, and state of residence, and they can be certified to sell this insurance. And then they can get into the healthcare.gov website and or through its partners and make some of these changes. So there's been a real concern about that, and there's been some crackdowns on it as well. But that's been going on much of this year. There were more than 200,000 complaints about it just this year alone.
Yeah. Because, I actually have a friend who was going through cancer treatment and had that same thing happen with the plan switch. And in the middle of, receiving radiation therapy and, monoclonal antibody treatment and that kind of thing. So they were, they went to one of the sessions and they said, well, this is not the right plan. And they were like, what? I've been coming here already. I've been receiving treatments up to this point. And they had to go through a terrible time period trying to get everything reestablished and set up the correct way, to complete cancer treatment. And so that can be really alarming for people who are in those situations.
Right.
So what has been
At the
done to
very
try
time
to
when you
stop
don't,
this?
yeah, when you don't need, I mean, when you're already struggling with some kind of health problem, that's the last thing you need is to then be hassling with this insurance problems. It's very devastating for people.
Yeah. Emotionally and physically. Yeah.
Mhm.
And so what's been going on to try to stop this? And is it working?
Well, the Centers for Medicare and Medicaid Services, which oversees this, the healthcare.gov website, for example, has said that they've made some changes. So one of the things they've done is say that, okay, from now on, starting in July, if anybody is trying to make a change to a policy and if an agent is unaffiliated with that policy, meaning it's a different agent than perhaps the one that you had, that change has to take place in a three-way call between the consumer, healthcare.gov, and this agent to just confirm that, yes, indeed, this consumer wants to make this change. So that's one of the things that they have done. So these three-way calls for people who are unaffiliated with your policy, that may mean you have to get on the phone and do this three-way call when you're signing up or making a change, that kind of thing. That's one thing. The second thing they've done is they've barred about two of these. There's about a dozen private enrollment sites that link to healthcare.gov kind of on the back end. Consumers mostly don't see this, but they've barred two of them because they've had some concerns related to these switching problems. They've also removed about 850 agents that they suspected might be involved in some of this improper switching while they investigate those concerns. And some of these agents have been reinstated. Some of them were not involved. So that's been some of the pushback to this, is some of the legitimate agents are saying, hey, wait, some of our good guys, so to speak, are getting caught up in this effort. But some of them probably were part of the, could have been part of this switching problem. So those are some things that the Centers for Medicare and Medicaid Services have done. There's also been a lawsuit filed that's alleging that a lot of this is going on, and it's representing consumers, but also some agents who lost business as a result of this. And so that's ongoing. But what that lawsuit also did was highlight some of the ways that people were getting caught up in this, which were some of these advertisements online, on social media, text messages that were purporting to say that people could get thousands of dollars a month towards groceries or rent or gas if they just clicked on this or called this number. And those clicks or calls sometimes led people to a marketing type effort. And then their information was sold to agents that then might have been involved in signing people up. And also some of these people may have actually wanted to sign up for insurance and they thought they were going to get this gift card. They were sold insurance. They got insurance and maybe they wanted it, but they never got the gift cards because those don't exist. There's nobody giving out $6,000 a month to help with groceries and gas. So that also kind of highlighted this. So I think there's more awareness. Whether it's working or not, because you asked that, I think we don't know exactly yet, but CMS, the Centers for Medicare and Medicaid Services, say its efforts are working. They point to a 30% drop in complaint casework in the last couple of months. They've also noticed a 90% drop in the number of times an agent's name was replaced by another's on these policies. So they're pointing to that and saying, look, we think this is helping.
Oh, that's fantastic. I mean, at least they're trying to do something. And it's really, when you have criminal behavior out there, which I can put this into an immoral criminal behavior, with people, playing with people's lives and their health, that's something that at least, the federal government is facing and trying to do something about it. Unfortunately, we live in a society where that even happens, and the federal government has to respond and find ways of trying to deal with this kind of issue. But what happens next? Are there other steps being proposed, and what about being under the Trump administration, incoming administration? Because we're going to maybe see some shifts in policies or how things are viewed. We don't really know who the cabinet members are going to be officially yet, and what their real perspectives are and how they're actually going to unfold things. But, any views about the future, or, direction that you would like to see things go in? Or
Well, let me just say a couple things. So what needs to be done about this switching? And then there's also some ACA questions here as well, just kind of general. But
Yes.
some of the agents feel like what CMS has done is a step, but they still feel like there needs to be more security. So it's like two-factor authentication, for example. A lot of that happens like in financial services, right? You try to do something on your bank account and they send you a code, right? So something like that. They've been pushing for that. And some of the states that run their own marketplaces have that kind of a layer of security in addition. So we may see something along those lines. I'm not sure. That has been discussed. It has been brought up. Now, as far as how to not have this happen to you, as I mentioned, don't fall for these advertising scams. If you get mail, read it. Some of the people I interviewed that had been switched had been getting mail from insurance companies. They thought it was advertising, so they just threw it out. But it was actually their new insurance company welcoming them to their insurance plan, and that they don't even know they have. So read your mail.
Yes.
And also, maybe a couple of the folks I interviewed only found out when they went to the pharmacy, and then the pharmacy had a different insurer. So ask when you're filling a prescription, and just double check and make sure it's the same insurance plan that you were with. Now, I think your other question was, okay, so what happens now with the Affordable Care Act under new administration? And I think we don't all have we can't say for sure, but. Right. Like I mentioned, the enhanced subsidies, that is definitely going to be something that Congress and the new administration are going to weigh in on, because that it expires at the end of 2025. So look for a lot of debate around that. Another thing that the prior Trump administration was really big on was loosening some of the rules around non-ACA plans. So these plans, something like a short-term plan that you buy when you're between jobs, for example, or you just graduated school, but you haven't started your job yet, so you don't get insurance.
Yes.
They allowed those to be sold for longer periods of time, a year, basically. And then you could renew them if the insurer wanted to renew them for another 2 years. The Biden administration rolled that back to at most 4 months, because these are generally plans that don't have sort of the comprehensive coverage that others do. They can also what's called underwrite you, which means they can ask you health questions and they can turn you down if you have a health problem, whereas they can't do that in the Affordable Care Act. But I wouldn't be surprised if those get extended again so that people can buy them for longer periods of time. And then we may see some other sort of non-ACA kind of plans, the rules around those loosened. So there may be more options for people, but people will also need to be savvy shoppers and really look at what it is they're buying.
Yeah, that's a really good point, because when you were saying that, I was just thinking that if you're between jobs, many times people go out on Cobra. And the first time I heard that term, I saw the fangs of the snake, because it has a tendency to be very expensive.
Yeah.
So, but that may be an incentive for people to try to use a program like that you're talking about, because it may seem cheaper, but then you have this underwriter who's actually combing through and cherry picking who's actually going to be covered or not.
Mm-hmm. And then you have to answer those health questions and just be very careful that you answer them all correctly. But
yes, yeah.
Another problem back, ACA plans can't do that. But I remember covering the individual insurance market before the Affordable Care Act, and people would sign up for coverage. They'd fill out those forms, but maybe they didn't write down that, I don't know, they saw a doctor for a headache once or twice, or some other kind of problem. And then they got, I don't know, cancer later or something like that. The insurer could then go back and look at their questionnaire and say, oh, you didn't tell us about that headache or whatever it was 5 years ago. So we are going to retroactively cancel your policy. So those kinds of things can't happen with a plan under the Affordable Care Act, but they can, in theory, happen with a plan that's underwritten. So again, people need to kind of be aware of that and kind of watch that if they're buying a plan that's underwritten, that it could actually even be canceled.
Yeah, because also one of the things in the background, and we have about 2 more minutes to go, but and maybe we can come back on. We're going to be talking about this. I know throughout the next year, and that kind of this topic is so germane. But even Medicare and Medicaid issues are going to be interacting with this as well, and how do those things balance?
Yeah, we could do a whole program on that because we didn't even talk about that. But Medicaid expansion is also part of the Affordable Care Act, and many states have expanded coverage. But there's going to be a lot of discussion around Medicaid and funding and how that's going to play out in the next Congress and the next administration as well.
Yeah. Well, thank you so much, Julie. We're out of time, but always enlightening. Thank you for the work you're doing because it enlightens people about what they need to know about their health. And so I read your news articles all the time because they are really powerful. So thank you for what you're doing, and stay with us. We have another show coming up shortly. Don't go anywhere.